Word from some voices about our work at Radiosurgery New York for cancer treatment.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and talking about cancer treatment. I had a letter, an email actually came to me yesterday. This is a family, one son in the family I took care of 20 years ago for prostate cancer. He had high-risk cancer. He came to us. We treated him. He's cancer-free 20 years later for Gleason 7 cancer. And you can look at our data and other data, and you'll see how our data is, which is fantastic. Anyway, the mother has a pancreas cancer, and 6 months ago, her doctors persuaded her to go on hospice, which she did. They told her she'd be not with us 6 months later. Well, this is a letter I got from the family, who's very concerned that she's still here and on hospice, and they're wondering why. Well, we took Mom to Dr. X, the oncologist, yesterday, and she was stunned at how relatively well Mom appeared since she first saw her in March. She did not agree with the hospice doctor that the cancer was much bigger and spread, at least on a physical exam. She readily agreed to order a PET scan and recommend Mom come off of hospice. We then stopped by the hospice office and completed paperwork to effect that. Today we'll contact the insurance company to put Mother back on coverage for testing and treatment, and we'll try to get this scan done as soon as possible. Regards, and this is the son, who's a PhD, one of the big universities. So, yeah, you can get off hospice, and you may want to get treatment before you go on hospice, because no one knows. We're not God. Doctors are not God. We don't know how long you're going to live. This woman wasn't treated. They even think the whole diagnosis was wrong. I've encouraged them to come in. This has been an ongoing conversation for 6 months. And now they're coming back to me thinking, maybe I was right. Yeah, maybe I was right. Maybe they were all wrong. So before you jump in hospice, which really is care, but it's not medical care, maybe they'll get you a bed and narcotics, but it's not actual medical care and treatment. And I've been urging them to get a PET scan, seeing exactly where the cancer is, and considering treatment rather than just waiting for end of life. So yeah, hospice has a role. I'm not opposed to hospice. Everything has a role, but has a role at the right time. And sometimes it's not the right time, and we often see that. And we have many patients who come off of hospice because it hasn't provided them what they've sought. And sometimes patients and family seek treatment with a chance to live longer, hopefully even to be cured. So we'll report back to this lady who's been on hospice for more than 6 months, and now they're upset. They're upset because what they were told is not the case. And speaking of pain, there's a new article in Oncology Times that says not all pain is equal and not all pain requires opiates or narcotics. This is an article by Robert Carlson in Oncology Times saying there are different kinds of cancer pain and not all of them require opiates. For example, pain management might at various times mean management of suffering, rehab, function, counseling, or other maneuvers. We at Radiosurgery New York often find patients respond to radiosurgery. What causes cancer pain? Well, often it's the cancer growing, eating at the nerve, and if you can make the cancer go away, it gets the pressure off the nerve and the pain goes away. So most of our patients have a quick relief of pain, a quick relief of suffering in a non-invasive method. Sometimes we even recommend medicines as simple as ibuprofen, which is Advil, or Motrin, 200 milligrams, which helps the majority of patients, but that doesn't treat the cancer. So radiosurgery, which is a non-invasive method, treats the cancer. It focuses the beam at the cancer. Usually it's just 5 treatments. It's quick, easy, and usually very effective. And there's a new report. This was published at and presented at the Astro meeting in San Francisco, that radiation for early breast cancer does not increase lymphedema. Now, what's lymphedema? Lymphedema is swelling of the arm, and you may have seen people walking around with a swollen limb, especially women with the right or left arm after usually radical surgery or big surgery and going in and dissecting out the armpit. Well, often when surgeons dissect out the lymph nodes in the armpit, they're stripping the vein, which hurts the vein, which hurts the lymph channels. There's basically 2 systems in the body to circulate fluid. One is the blood vessels, and another is the lymph system, with stops at the lymph nodes. Well, if the surgeons remove those lymph system vessels, the fluid backs up. Wouldn't be surprising. It damages the vessels, damages the highway backs up. So there's a big push right now to try to get surgeons to avoid doing those big operations in the armpit for breast cancer, either resecting just what's called the sentinel node or the main single lymph node, or give radiation instead. And this study, which was presented at Astro at the scientific meeting by Susan McCluskey, showed there was no evidence to suggest detrimental impact of chest wall radiation or breast radiation on lymphedema beyond the surgery. So there's lots of ways to avoid the complication. One way may be radiation for women with breast cancer and avoid the big operation in the armpit. And again, I would encourage you to give us a call, or better yet, come in so we can talk about it before the surgery to try to avoid lymphedema, which can be a lifelong painful problem. We're just about at the end of the hour. We do have a new show on tonight at 9 p.m. on WOR, and starting next weekend there'll actually be another new show on every week, which is 9 p.m. every Saturday night. So we're well represented on WOR with shows at 1:30 to 2:30 a.m. on Sunday morning, 3 to 4 a.m. This show 6 to 7 a.m. Sunday night, 9 to 10 p.m. And next week, Saturday evenings at 9 to 10 p.m. So if you have questions during the week or during the day, medical questions, please call us at 212-CHOICES, 212-246-4237, 212-246-4237. If you want the booklet and the DVD, call us during the work week. Our office is open 8 to 5, Monday through Friday. Or many of you are in Manhattan. You can just stop by at 38th and Broadway. Come in and pick up the booklet, the DVD. There's a whole series of booklets, DVDs, and even now an MP3 of our radio programs. So if you have questions, please call me directly, Dr. Lederman, 212-CHOICES. Have a great week. Thank you for listening, and God bless you. Bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
You've been listening to a podcast from News Talk Radio 710 WOR. 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 WOR.